Good afternoon, everyone. My name is Sean Carey, the city manager here in Sparks. I wanted to thank you, first of all, for coming by this afternoon and spending part of your day on our agenda. We will be recording this session today, so as you do ask questions, Chris or Jeff will try and restate the question so that we can capture that, so that the tape can be used for all employees to see it. But I do thank you for coming here in person today. This is our third session today, and I think we've had the greatest turnout I've ever seen for one of these briefings. So this morning we had standing room only. This being the latter part of the day, I hope you'll get a lot out of this, and it should be informative. We do have an agenda today. Jeff Kronk is going to talk to you about next fiscal year's budget. And we are facing a challenging budget next fiscal year. It's about a $4.6 million deficit that we're facing, and we've got to take action to solve that. We have filed a balanced tentative budget for the city, and what Jeff is going to talk about today is just some of the things we're looking at in the final budget as recommendations. Most of our questions and the bulk of today will be to talk about a proposal the city has for a change in the healthcare plan. And in my recommendations, you'll see that I'm recommending that in lieu of a 6% wage cut for all employees, that we institute this new healthcare proposal. Not this healthcare proposal as presented today. This is the concept, and we're just starting the process of working through finding something that has the balance that employees are looking for. The idea is to avoid layoffs, to avoid additional wage concessions, and put ourselves in a smart place with our health care costs for next year and into the future. The last part, if we have time, we'll get into questions and answers. We're going to have to move quickly because at 5:30, Tracy has the Parks and Recreation Commission in here. So we have about an hour and 15 minutes to get through this. So if you can help with asking all your questions, but doing those quickly. Chris will restate those. If she isn't restating your question properly, just let us know because we don't want your question to be rephrased. Jeff Kronk is going to start us off, and you should all have two handouts. The budget one is the one page, front and back, and then you should have a handout that covers the budget. And last night, all employees received the PowerPoint of the healthcare presentation, so that's on the internet for you to go back and look at. And we'll post the one-pager on the budget as soon as we can get that accomplished. With that, this is Jeff Kronk, our Finance Director.
Did everybody get the handout he was talking about? We have extras. Okay, good. Okay, actually, let me change the slide here. Very briefly, like what Sean was talking about, I just want to give you an update of where we're at, budget-wise. We did file a tentative budget, as he mentioned. He's not done.
I hate to do that to Jeff, but
Oh, no,
I'm remiss because I wanted to, Ed Lawson, could you come up for just a second? This is our newest council person, Mr. Ed Lawson. He represents Ward 2 of the city of Sparks. I wanted to introduce him to you. He's here today, and I just invited him to just say a few words. So that was my error, Ed, and I apologize, Jeff.
I told him I didn't want to talk. I thought he'd actually listen to me. I just want to say thanks for showing up. As you guys can imagine, this has been a difficult process for me to come in brand new as a new councilman and try and learn what's going on in the city. I have several hours invested in reviewing this health plan, and I'll tell you what, I'm pretty excited about it personally. Even from my own personal benefit, I think I'm going to choose this route for me and my family because I think it's a good deal. I think as you go along, you'll see some of the benefits of it. I know it's a little scary. I told Sean, I went home and explained it to my wife the other night, and her first reaction was, that just doesn't sound right, or that's crazy, and then as I kept explaining it to her, she finally understood it and then said, you know what, that does make sense. So I hope you'll listen with that part of your brain that's open and willing to look at some new ideas. And If you have any questions, please feel free to contact me or call me or whatnot, and I'll be happy to do whatever I can to help you out. So thank you. And with that, Jeff?
Thanks. Okay, so where we were was where we're at. We did file a tentative budget. We're required to do so by April 15th. Now the hard work comes into play. We've got to file a final budget now. We have to do so by June 1st. So on that two-page handout that you have, if I can get one here, on the two-page handout that you have, the front part, this part here, is the city manager's current budget recommendation, which is probably one of a dozen different ways that we can find our gap. So let me back up half a step and tell you kind of where we're at. Way back in the summertime, we started this process. We started our budget very early around here, and we didn't know what to expect. So we started with a range of cuts that we were expecting, and it was anywhere between $2.8 to $5.6 million. So a lot of unknowns during the summer. It was way before the legislature was happening. We still didn't have the valuations from the assessor's office. C-tax was still unknown. We're coming off some drastic declines. So we had this range. Well, as we go through the year, we're able to narrow that down a little bit, and that's kind of where we're at right now. We're at a $4.6 million gap. Still a lot of unknowns out there. The legislature's not done, being probably the biggest X factor right now. But what we know from the economy, on the data that we have right now, we're looking at a $4.6 million gap. And that number really hasn't changed for several months now. So on this first page is, again, like I said, the city manager's current recommendation to council that he's going to be presenting formally on May 9th. And then the council will be giving us direction on that, and then we'll look to get formal approval of the budget on May 17th before the June 1st requirement. So that's kind of where we're at. The second page, if you will, is on the flip side, is basically all the options that the council has to decide that we've identified to date. You'll see it's a total of about a $7 million worth of different options, and then there's some add backs on the right-hand side there, if you will. These are things that they can choose from. A lot of them are policy related. A lot of them we've discussed at various workshops. So these are the kinds of directions that we're looking for council direction again on May 9th. So with that, I wanted to, again, step back half a step here a little bit and kind of give you a brief description of how we got here. And forgive me for not having these handed out, but I wanted to read off to you a little bit of kind of what you're looking at here and how we got to this picture. What this picture is showing you are the bars, if you will, the columnar bars, are the assessed valuation for the city of Sparks, and then the three lines are our three primary revenue sources for the general fund, so our operating fund, if you will. Those revenue sources account for over 85% of our total revenue. So this is what we have, this is our stool. This is our stool to sit on, so to speak. And it's been being shaved off pretty good. Those legs are a lot shorter than they used to be. The blue line there, as you can see, is the C-tax, the consolidated taxes. Really, it's mostly sales taxes. The red line is property taxes, and then I guess that's like a purple line is our licenses and permits. What you're seeing here, especially on C-taxes and licenses and permits, we're finally seeing some bottoming happening. We're seeing some leveling out. You can see those are pretty dramatic declines that we saw as a result of the recession. Well, we're finally seeing some stabilization happen. Not so for property taxes, and we're still struggling in that area. I've been doing a little research on it, and as you all know, and have been reading the papers regarding your own home values, it's not a pretty picture. I follow the median home price. It's probably the best one that we have that kind of tells us what's going on in total within Washoe County. And the peak value is at $350,000. It's now dropped 54% off of that and is hovering around that $160,000 mark. So, we all know that story. Well, we're seeing it from a city perspective. That's that red line. And you'll see that that has not leveled out yet. We're waiting for that to level out, and it probably won't for another year or two. It depends on how that works out. I think going into not fiscal 12, but even looking forward into fiscal 13, we probably still have another $1.5 million risk to our revenue before that starts leveling out. So that's my expectations. Again, we'll have to see what happens. A lot of it has to do, well, everything has to do with how the assessor values each individual property. So you kind of have to wait to see how that plays out on an individual parcel-to-parcel basis. But let me read you just a couple of things just to show you where we're at. Property taxes, like I said, they peaked in '09, and they're down 18.5% from there. C-tax is down a full third, 33.3% from '06. Licenses and permits were down 25.6% in '07. And I guess I really just wanted to say that we're seeing some leveling out in the areas, but we're still seeing some struggles. I did get just some recent numbers from our community development department, and on our permits that they issue. These are staggering numbers, but the permit value from '06 when it peaked is down a full 83.6%. That's a staggering amount. It's just gone. Construction is gone, but it's still declining. Even last year, we're down 36% in calendar year 10 versus calendar 9. So, it continues. So with that, I just kind of wanted to give you, just kind of a brief overview of kind of how we got here, where we're at, what we're still struggling with. So, but I really wanted to save most of the questions, or the time for what Chris is going to be talking about. But are there any questions on that real quick? If not, I'm going to turn it over to Chris. Okay.
Thanks. I think I might. Okay, is that on? All right. So the city council, I was talking about business units, and what that means is we're getting ready to implement, and Rich has been part of this process, the new HR payroll side of Aggresso. And we needed a term versus resolution, bargaining unit. We're always going back and forth. So what we did is we coined a term called business unit. And that just means whatever you're covered under. So you'll hear me refer a lot to business unit today. And that'll mean if you're under a bargaining contract, that's your contract. If you're under a resolution, that's the resolution. So that's the term for business unit. But the city council said go to each business unit and talk about a 6% pay reduction in pay or benefits. So we got together and said, is there an alternative to a direct salary cut? So for the MPT resolution, we took a 7.5% cut. Our resolution says that we'll be scheduled to take another 7.5% July 1st. Well, that's just not very appealing to most of us in MPT or executives or confidential. And I know in some of the other business units like SPPA, IFF, OE3, they're not looking forward to a straight salary reduction either. So we wanted to present options, and that's mostly what I'm going to talk about today is an option to the 6% cut. And I have to tell you, it really depends on your own situation as to whether you think this is a good idea or not. And today, what I'm trying to do is to present a scenario. A lot of the things that we'll talk about today are things that need to be bargained with the bargaining units. So they're not things that I can say, this is the plan or this is how it's going to be, because it has to be handled over a negotiating table with the bargaining units. We also have to involve the healthcare committee at a tremendous amount, and I'm glad you're here, Sean, so you get to hear it again. It's a little bit different. And but I think what I wanted to do today, what we wanted to do, was to just open your eyes to another possibility. So, oops. This is my disclaimer. To preserve the integrity of the negotiating process, again, all of this will have to be negotiated. And Dwayne, I'm glad to see that you're here too, so you can hear this information for your group. So Thanks for being here. Dwayne is our business representative for Operating Engineers Local 3. The healthcare dilemma. Not any news to anybody in this room, but costs are continuing to rise. We have had a fairly good year this year in the health plan, which means that we haven't had any big costs. However, the year's not over yet, and we've just had some big ones hit. So healthcare is very, very unpredictable. And again, I don't think that's a surprise to most of us. It's also unpredictable to you as an individual. Utilization is unpredictable. The city, as the way it stands right now, really has no way to control the escalating costs. Our benefit plan design is just, every year as it goes up, the city just pays more and more. Now, we've worked with the healthcare committee, and I don't want to diminish their role, to try to bring in some changes. And we have over the last, was about 3 years ago, that we really implemented, you all know, the big changes in healthcare. But we still need to do more. We have an aging population. We also have a bigger percentage of our participants in our health plan are retirees. Through our early buyouts, through retirements and layoffs, we have more people that are retirees now rather than active employees. So even though you may think that we don't have as many people on the plan, sometimes they just move from active to retired onto our plan. And unfortunately, retirees account for proportionately a larger number of our claims than our active employees. It's an expensive group to cover. Technology advances, while they are wonderful, also are very, very costly. The Da Vinci surgery systems, the MRIs. I don't know, when they first came out, doctors really only ordered them if you really needed them. And now I think every time you go, well, let's just get an MRI of that, or let's get a CAT scan of that. And while that's a good thing, it also increases the cost of our plan. So healthcare reform alone is scheduled to increase our plan costs 3 to 4%. You may have received the information from Jen McCall that you can now add your children back on that are up to age 26. Great thing to get them covered. Not so great thing for our health plan. Cost reduction in the current plan. We have been working with the health committee, but we haven't made any changes in the last couple of years in the health plan. So we're still working on that. The following are options to consider. So when we looked out there and we said, okay, 6% in wages or benefits, what's that look like? Well, we could take a 6% salary reduction, which is what OE3 has agreed to do, which is what is in the management executive resolutions. Actually, it says 7.5. That would be reduced to 6 to be equal. We could make modifications to the current health plan. We could also make contractual changes outside of health plans. So some of our bargaining units, for example, gave up uniform allowance. And so there's other things in the contract that you could look at to come up to that 6% difference. You could also consider implementing a high deductible health plan with a health savings account. And that's what we're going to talk about today mostly. Or you can negotiate benefits outside of the city plans. And that's also something that we're going to talk about. If we were to say we want to keep our current medical plan and we just want to make changes in the plan that would equal that 6% reduction in pay or benefits, some of the things that we might have to do could be raising our deductibles to $2,000 and $4,000, increasing our out-of-pocket maximums, requiring employees to pay a part of their insurance, and the last one, implementing formulary optimization, and it really probably doesn't mean much except to the healthcare committee, and that is changing the way that we pay for some of our prescription costs. So a technical term, but it's something that we've considered for quite a while. Better plan, we thought, was can we create a plan that covers our expenses, maximizes value, is flexible, and allows employee choice? Right now, we don't have a lot of choice in our benefits. We're either covered or we're not. And if you're covered on medical, dental, and vision. So we're going to talk about some options to that as well. A health savings account. I'm sure by now you've heard it or you've seen material that I've put out that talks about a health savings account. A health savings account is an account that you put money into, tax deferred, similar to your 457 plan or 401k plan, if you're familiar with that. So it comes out of your paycheck pre-tax and it goes into an account. The difference about and the HSA funds can be used to fund current or future benefit costs. So if you put money into an HSA account, you can use it like you would your flexible spending account to pay for your deductibles and co-pays and eyeglasses and things like that. Or if you have money still in there, you can use it to pay for expenses at retirement. So you could pay Medicare Part A and B, A or B, Medicare Part D, all of those things you could pay for out of your health savings account. The difference between a health savings account and a flexible spending account is that money rolls from year to year. So if you and the city put money into it this year and you don't spend it, that money will roll over from year to year. And it will continue to grow, and it will continue to earn interest. The interest and the money that's going in is tax deferred. It's also tax deferred when it comes out, as long as you're paying for eligible medical expenses. So the way that this would work is we would go to a Hartford, an ICMA, a Wells Fargo, a B of A, and they would set up individual accounts for anybody who had a health savings account. And they would give you a card, like a credit card, debit card. And you would use that card when you go to your healthcare provider to pay for your expenses, just like you would with your flexible spending account. You could also take that card and you could go buy a new TV at Best Buy. Now, what would happen is at the end of the year, you will get a 1099 form from whoever it is that's managing our account that shows the money that came out of that account. And if you're using it correctly, you would have receipts that would amount to the amount that you took out. And should the IRS audit you, you would show them your receipts, everything's good. If you spend it on a TV and you don't have a receipt, then you're going to get taxed on that money, and you could possibly pay penalties for an early withdrawal out of that fund. So the money is yours to be spent however you want to do it, but there are tax consequences if you don't use it in the right way, in the right manner. The account is portable, so if you leave here, it's still your account. You take it with you. The interest and the money that goes in is tax exempt, but you can only have an HSA account or a health savings account if you have a high deductible health plan. They go together. We can't just do an HSA. So let's talk about a high deductible health plan. A high deductible health plan by law says that you have to have a minimum deductible of $1,200 and an annual out-of-pocket maximum for individuals of $5,950. For a family, it's $2,400 deductible and $11,900 out-of-pocket maximum. And this is the next is a very important statement, and that is that you don't get into the benefit levels of the plan, meaning your 80-20, until the deductibles have been met, and that includes your prescriptions. So right now, our prescriptions are a little bit separate from our medical, so regardless of whether you've met your deductible or not, you can use your $5, $15, or $40 copay for prescriptions. But under a high deductible health plan, you would have to pay out of pocket for your prescriptions and your medical costs until they hit that deductible level. So now I'm going to throw a new one at you, and that is the concept of a composite rate. So we've heard over the years that single people really feel like it's not fair that we're subsidizing families. So I use Teresa as an example. Teresa, you may have your family covered and the city's paying $18,000 a year for your coverage, where I may be single and they're paying $6,000 for mine. And how is that fair? So what we really tried when we were looking at this plan design, and that's all it is a plan design option, was to go to a composite rate. What that means is we have one plan for everybody. Under the plan that we're going to look at today, everybody has a $2,500 deductible. And that's one $2,500 deductible if you're an individual, or it's a combined $2,500 deductible if you're a family. Okay? So when you're a family, you can use one, or you can use however many people in your plan to get to that family deductible. So if you look at the plan design that I have up now, the city is proposing to make a contribution to your health savings account at $1,500 a year. So what that means is we would take $125 a month and put it into the health savings account for you. Now, we'll put $1,500 in. Your deductible will go to $2,500. So in theory, you're about $1,000 more that you would have to come out of pocket. And we're going to talk about how those comparisons are. But this is basic plan design. The difference is we would put money in your account. The deductible is $2,500. And the out-of-pocket maximum over and above the deductible is $3,450 for everyone. So this is kind of a confusing concept, and so I'm going to try to, let's see, Amy called it dummy it up so that I could figure it out. And that is to say, the first $2,500 of charges you would have to pay. So it would either have to come out of your house savings account, you would have to pay for it out of your pocket, or whatever. $2,500 deductible. After that, we go into the 80-20 mode, right? You're used to that after your deductible. So you pay 20 and the city pays 80 for the benefits past the deductible. And we would continue to do that until you've reached $19,750 in claims. After that, everything's paid 100%. The claims are paid 100%. So the maximum out-of-pocket that you as an individual or as a family would have to come up with is $5,950. So that's your deductible over and above what you're paying now. That's your deductible, and that's your co-insurance level. So it's a big difference. Right now, if you're an individual, your out-of-pocket maximum as an individual, including deductible, is $1,200. As a family, it's $2,400. So to go from $1,200 to $5,950, or to go from $2,400 to $5,950 is a big change. And that's the difference in this health plan. I'm not trying to hide it, not trying to pull it fast, but that is where the cost is going to go. Now, also, there's a note at the bottom. For the first year, and all of this would be effective January 1st of 2012. We can't change deductibles and copays and all that mid-year. So none of this will go into effect until January 1. But January 1, the city would also put an additional $750 in your health savings account to sort of kick it off, if you will. So in the first year, we're going to contribute more into the plan. We're going to contribute $2,250 into the plan. Again, this is all just a concept. We would work with the healthcare committee and with the different bargaining business units to figure out what is the final plan that we want to come up with. I've heard from some employees that they don't like this whole composite idea of one rate for everybody. They'd rather go back to the individual and family. So that might be an option that we go back and look at. This is just one plan that we're doing. The rest of the benefits are the same. The hospital, the doctor's visits, it's all still 80-20 if you utilize in-plan and 60-40 if you utilize out-of-plan. The difference is preventive. The plan that we are looking at is very preventive-friendly, if you will, and that's the one exception to the deductible. Any of your annual preventive exams, like your mammogram, your physicals, your immunizations, your well baby checks, those can all be paid out of the plan, and you don't have to meet your deductible first, okay? So that's the one thing that we can pay separate from the deductible, if you will. As I mentioned, prescription drug benefits. That's the one difference. Now, what would happen is if you are on a prescription drug, and I'm just going to say Lipitor because I think that's our highest drug usage for the city, is Lipitor. If that drug actually costs $500 for the city to fill, you'd have to pay that $500 up front for the first, until you get to your deductible amount, okay? Once your deductible is met, your $2,500 deductible is met, then we'd go back into the $5, $15, or $40 copay. It's really important for everybody to know that because this is a big change. Prescription and medical are combined now into one. The difference to you as an individual or you as a family, and this is taking the deductible that we currently pay. So as an individual, you have a $200 deductible, and your out-of-pocket maximum is $1,000. So combined, that's $1,200. Under the new plan, it's $5,950. So the most additional that you would have to come out of your pocket would be $4,750. That's a lot. That level is only reached when you hit $19,500 in claims, which doesn't sound like very much. But I just ran a report, or I had CDS run me a report, and only about 24 of everybody that's covered under our plan, and it's about 1,500 people, I think, is covered under our plan, only about 24 hit that $19,000 level. So it is a small percentage of our employees that would actually get hit with that big. Yeah, Janice, was that you? No, not. No, sorry, HIPAA regulations, I'm not saying a word. It could be me. But you really have to look at your own medical expenses. And CDS has agreed that they will run a report for anybody that will show exactly what your medical expenses have been last year and the year before and the year before. So you could do kind of a running 3-year. This is what what your claims have been running, because it really is an individual plan and how this is going to impact you. And I would suggest that everybody take advantage to learn as much as they can. But I talked about a cafeteria plan, and this is one of the things that I really like about this plan, and that is letting employees choose the ability to pick and choose what they cover. So what the city has said, and this is a new concept as well, that right now we have to budget $9.1 million for our claims for the city. So what we did is we took this plan design, we priced it out as a total, and we said, how much does that work out to per employee? And it's about $13,655, not to be exact, but pretty darn close, per employee. So under this plan, you can elect medical, dental, and vision for you and your family with a $1,500 contribution to the health savings account, and you're good. But let's say you have the opportunity to pick your husband or your wife's or somebody else's dental plan, or you really don't need dental, you're at the point where you're only paying for cleanings twice a year, and that's a couple $100, so you want to opt out of dental. We would then allow you to put that additional savings from dental into your health savings account to help offset your total costs. Or if you want to opt out of vision, we would let you take that money and put it into your health savings account. Realistically, if you've got new glasses this year, you know VSP is not going to pay for glasses again next year, so you might as well opt out. The beauty of this plan is that you can opt in or out every year. So during our open enrollment once a year, you can add or change your benefit selections. So you can make these elections once a year. We also wanted to throw in an opt-out. So let's say that as an individual, you say, I can get covered under another plan, or I can go and buy a plan that better fits my individual needs than what the city is providing. We would let you opt out, but we're only going to pay you 65% of what we would pay had you been in our plan. There's a couple reasons. One is we've still got administrative costs to cover whether you're in the plan or not, and whether we have 5 people or we have 500 people. The other thing is what's called adverse selection. And adverse selection is a term that's used in a lot of different instances, but in healthcare, it's a very specific meaning. And what that means is that your healthy employees will pick one plan, and your less healthy employees will pick another. And it totally will mess up the balance of your plan and the risk of your plan. And we don't want the lure of cash to lure people to get rid of their healthcare coverage altogether. Times are tough, money's tight. But we want to make sure that people still have healthcare coverage of some sort. So we're building in some incentives and some disincentives to have that covered. If you choose to opt out of everything, okay, opt out of everything, we would give you $8,120 a year. Just give it to you. We would have you show us that you have coverage somewhere else, and then we would give you that money. What we did is we really originally wanted to put it in your deferred comp. Sean was really strong on this, but the law limits us and says we can't put it into your deferred comp. But we can give you the $8,000, and you could put it in your deferred comp if you wanted. But that money is going to be taxable to you. We have a couple of other options for business units. So I talked to Dwayne the other day, and I said, Dwayne, does OE as an organization have its own insurance plan? And it does. So it has a lot of members in OE, not city employees, that buy their coverage through OE as an organization. IAFF, I think, is the same way. They have national insurance coverage that they can buy. If a business unit, one of our bargaining units, decides that they can buy that coverage cheaper, medical coverage cheaper, or a better plan, or they just want out of the city plan, we'll say, fine. We will give you 80% of that $13,655. Go and have your own plan. If you take your retirees with you, because we talked about retirees being expensive, we'll give you the 100% value. So we would, give to operating engineers, let's say, $13,655 if they were to take their employees and cover them on another plan and take their retirees with them. Does that make sense? But that has to be done on a business unit, okay? So you can opt out as an individual if your unit is in this high deductible health plan and get the money. But as a unit, they have to opt in or out. Does that make sense? kind of? Okay. What does this mean for employees? And I just put up an example. I took an employee at $40,000 that's single. They make $40,000 a year. 6% salary cut is $2,400. Really simple math, right? When we look at the difference in deductible, so if they're single, they're deductible $200. Your deductible has to come up with an additional $800. Again, you have to weigh the $800 versus the $2,400 and what's a better deal for you. You also have to weigh other expenses out after the deductible. Are you someone who would traditionally go up to that $19,000 claims level? If so, you could be looking at a lot more out of pocket. Okay. If you're a family, as employee B, same salary, $2,400 is still 6%. You had a $400 deductible as a family. Your deductible is now $2,500. So the change or the difference is $2,100. We're going to give you $2,250 the first year. So you actually would net out an additional $150. Thank you. Okay. Is it on? Okay. I'm just not used to using microphones. I just have a tendency to just project naturally. If you are in year 2, and we're going to contribute $1,500, and the deductible increase to you is $2,100, then you could, to meet your deductible, have to come up with an additional $600 out of your pocket or out of your health savings account, however you want to look at it. Okay? There's other examples in here. I did different salary levels, so you could pick the one that is closest to you, and that's in the presentation that I emailed everyone yesterday. Let's go through some of the basics and some of the other elements of a plan that we've been looking at. New deductible, $2,500 per person. Health savings account, $1,500 a year, plus an additional $750 the first year. We threw in a little bit of an incentive, and this is something that is really inherent to the plan. I believe that employees will become better consumers of health care. When that first $2,500 is coming out of your pocket or coming out of your health savings account, you're going to shop around for your care. Now, there's a couple things. Was it last month, Sean, we had Catalyst come to us and talk to us about this new thing on their website where you can go in and you can put in the prescription that you have, and it will tell you the cheapest place to get this prescription. Cheapest for you and cheapest for the city. What most people don't know is that if you go to, let's say, Costco versus a CVS versus a Walgreens, you may pay 15 or 5 or 10, 15 or 5 or 40 the same, but what is charged to the city is different. And most people don't even have any idea how much their prescriptions are really costing the city. So our insurance provider, Catalyst, for prescriptions, has come up with a website where you can go in and you can plug in your Lipitor at whatever milligrams it is, and they will tell you the best place to go for the best price. One of the things that people have told me that have plans like this is that employees become really good consumers of healthcare, and they find out where the best places to go for the best value. So if Costco really is, and I don't know if they are, the cheapest price, then employees will take their prescriptions there and go for the inconvenience maybe than the CVS that's right around the corner if it's going to save them a couple $100, you bet. We also found that although something like an MRI might cost $4,000 at St. Mary's, that same test might cost $3,000 at Reno Diagnostic. We don't have a lot of that data available. But I can tell you, once we implement a plan like this, if we do, employees are going to find out where you can go and where you can get your tests. So I think the plan overall will be in better shape because employees will become better consumers. To that end, if the health insurance fund ending fund balance increases by 2% or more, what we would like to do is to take 50% of that savings and put that back into your health savings account for you, or cash, or whatever you want to do. So if in fact the plan performs better than that $13,000 per employee cap that we were talking about, we would share those savings with the employee. It's an incentive for us to be better consumers and to get more money out of it. If it doesn't, however, then the group health committee is going to have to look at what kind of changes do we need to make to stay in that $13,000 cap per person, right? So it might be lowering what we pay into the health savings account. It might be increasing deductibles. It might be who knows what. But there's going to be consequences to the plan usage up or down. Not usage, performance maybe is a better word. Also, most of our contracts, resolutions, business unit agreements have a stipulation that employees started paying for deductible insurance if hired after a certain date, and it's different by different resolutions and agreements. But one of the things that we considered was that employees hired on or after January 12th would contribute 15% of the composite rate. So again, we would take out that family or dependent thing, and if you're hired after that date, you'd pay 15% of what that cost is. Again, these are just suggestions. We talked about opting in and opting out. We talked about the opt-out. We also considered utilization of your sick leave. So one of the things that we are concerned about is how to get employees to put enough money into their HSA to really help them out or to make sure that the money is there if they need it. And one of the options, at least I am concerned about that, me personally. And one of the things we talked about was the sick leave balances. We have a lot of employees with really generous sick leave balances that they've accumulated over the years. So we thought, what if we allowed employees to cash out 80 hours and let them take 50% of that in cash and put it into their health savings account to kind of, again, sort of kickstart this. And this is just a suggestion. The bargaining units may say, that's just silly, I'm not going to do that. Or why are you thinking 50%? I mean, there's lots of ways to look at it, but it's just an idea of a way to help employees get their health savings accounts going. Retirees, big issue. You might have told that they are a concern of mine. The decision has been made that people that retire on or before January 1st of 2012 are grandfathered into the old plan until they're not on the old plan anymore. And they're subject to changes in that plan that we would make as a group. But that is going to be set. Anybody who retires after that will retire under the new plan if we go to the new plan or if the units go to the new plan. But think about it, we're going to be running two plans simultaneously. So by law, retirees are not eligible to contribute into a health savings account. So that was one of the things that led to our decision to grandfather them in. They may want to, because the rate's cheaper. And so they may want to go into the health savings account and build that up. Or no, I'm sorry, they can't go into the high deductible health plan. Can't do HSA. Advantages, a cap on healthcare costs, sustainable healthcare plan. We've been thinking with healthcare, we've been talking about it for a very, very long time. We want to get to a point where we have a plan that is maintainable. A shift in the spending thought process of employees. I really think, and I've heard from people that have been in these plans, that it really does make a difference. You have full control over the account, and it is in lieu of a 6% reduction. So, Dwayne, for example, your group has already agreed to a 6% reduction. If they decided to go to the high deductible health plan as a unit, that 6% is gone away. It's not a deferral. And so it's just an option. Disadvantages. Definitely can be an increase in your out-of-pocket costs. I think that we built in a little bit of mechanism to help defer some of those costs or help minimize those costs, but they are there. And honestly, some employees don't want to manage their health plan. My husband's probably one, and he would say, just tell me what I have to pay and just go from there, right? Some people like the plan that we have. They don't want to manage their own account, and they don't want to change. That's definitely, we do have a lot of employees that want things to stay the way they are. Things to remember, you control the health savings account. You can use them to cover costs for you or a dependent. One thing I forgot to mention is for those of you that use your flexible spending for dependent care expenses, you can continue to do that. The flexible spending account will still be there for child care, just not the medical care. So if you're putting money into a flexible spending account now for medical expenses, you would simply put that into your health savings account instead. Okay? Balances roll over from year to year, and today is pretty much a concept. The details of the plan are still being worked out, but this is a good framework, and at least what we wanted was to open discussion on it and to put an option out for you. So with that, I'll answer any questions. Good. Yeah, I knew there had to be some questions. Yes.
Can you better explain to me with the recent pay increase for the 31 people in the city, the 5% increase, and then also their base pay being increased? How did that decision get made that those select few get that increase and then have an opportunity throughout the months for the performance evaluation to have additional increases?
Sure. I can tell you, I think it's been said before, but what we did is we went to the department heads and we said, what positions or what employees are working out of class or will be working out of class with this new reorganization? And we identified those positions that were working out of class or would be, and those were the positions that were reclassified. And the money to pay for that reclassification came out of the savings of the SSSI overall. Janice?
Earlier you had used the term, the savings account was tax deferred, and then the tax exempt, which one is it?
Mr. Carey.
Just please repeat the question.
Oh, I'm sorry. Janice, your question was the difference between tax exempt and tax deferred?
Well, I know the difference between.
No, I believe that as long as you spend them on healthcare expenses, they are tax exempt. My word was tax deferred because I'm used to using the coming out of your paycheck. Good question.
Chris,
Yes,
city council is part-time employees,
yes,
and they're benefited,
yes,
and no other part-time employees are.
that's correct.
So is there a reason that they're golden child per se?
I was not privy to the design structure when that came about. That's something that I inherited as an HR person, so I can't tell you the thought process behind it. Did I repeat the question?
No, that's fine. You just
Okay.
need help with the answer.
Thank you.
You know, an elected official is something which is defined in state law, and they are not part-time employees. They are elected officials, and as an elected official, they're neither part-time nor full-time. And so it is very, very common in an elected official status for them to receive the same benefits. And our city council has defined the benefits for elected officials by resolution, and they have taken the same benefits that are provided to the executive group of the city of Sparks. So there is a playing field that is established in law that they're entitled to benefits and are not part-time employees, and they have further selected, as a council, the level of benefits they wish to receive. Okay. Other questions?
Can I just ask one more? During all the budget cuts and with the layoffs, has HR been affected by that?
Absolutely. We combined the risk management, I'm sorry. The question was, has HR been affected? Absolutely. We combined risk management and benefits, and at one point we were at 11 employees, and we are now at 5, 6. We're now at 6. So we're almost half what we used to be. I don't know where that came from, because,
Well, the rumor was
Right.
going around the HR, there was maybe
I
only
know.
a couple people there, and they had not been affected, or were not employing anybody, were laying off. People said they were
Right.
wondering why HR was not being affected.
I don't know if that may have come about because we took risk management and combined it with HR, so it looked like we weren't losing anybody, but we did in fact lose 5 positions. And took pay cuts, if I just say that. Yes?
So 6%, say, of your pay and 6% of my pay obviously is very different. So people who make more of what I make, it's probably more an advantage to just keep the same health plan we're on rather than you, since it would be higher for you to take your 6% than someone like.
That's correct. That is correct. It depends on where you are.
How much you make.
I'm sorry?
Deductibles are the same no matter how much you make.
That's correct.
Just the 6% is going to change.
That's correct. It is a very individualized comparison.
Okay.
Yes, Rob?
What about just having everybody pay for a portion of their insurance?
So the question is, why not have everybody pay a portion of their insurance? Sorry, I'm trying to
You're
remember.
presenting a plan anyway to the unions.
Right.
that they have
That
to agree on.
absolutely is an option to be considered. Yep.
The delta of what you're saying, it's about $1.6 million. That's what a 6% across the board wage decrease means. And so if you take 6% and you spread it between 453 employees, it's going to be a big number in the changes that you would have to make on a contribution basis. The second thing is if you look at our long-term desire here, it's to put healthcare in a manageable cost for the city and its employees in the future. And the healthcare plan that we're on is not sustainable. And under this sustainable program we're trying to do, we are trying to find an agreement with our employees and our business units on a type of change that will lead to sustainability. Healthcare costs are going to increase, and it is subject to collective bargaining. It is subject to meeting with resolution groups. And those business units, we're asking and inviting them to come across the table. The budget recommendations on the one page, okay, I'm building in my recommendation to the council that they implement this healthcare plan. And in doing that, we are seeking no layoffs, and we are seeking no wage concessions. If you take that off the table, we still have to balance the budget. And so we would have to go back in, and it's got a multiplier to it because of the inefficiency in the healthcare plan that we have. It leaves us having to cut about 21 positions across the city. And, you know, a 6% wage increase after what employees have already given back in the face of this economy, this looked like a time to put this proposal out there, put it into your thought processes of what's the best decision for your business unit, and allow us to work through this together. It's a question that I want to be real clear on. We want you to look at this information, form a consensus as a business unit, and let us know where we want to go. For us, in management, we're going to balance the budget. It's going to be 6%, and it's going to be layoffs. Okay, we can avoid that by changing where we're choosing to put money, which benefits our employees. And we think that this plan is proven in other places to provide savings in where you make expenditures. And those will stop competing for future COLAs and all the other things, because it is a very high commitment right now for a city.
You could keep it, you're doing really good.
I have a question. If you're doing it for the budget for next year, does that mean that the employees who are staying have to decide whether, and their business units, whether they want this before June 1st, since that's when the budget is going to be given to the state?
The question is when, in this question, is when will you implement this plan? And my goal is to do that in a reasonable period of time, but I am going to ask the council to be authorized to carry out the necessary steps to maintain a balanced budget. So as we get into next year's budget, I'm building it with the healthcare plan recommendation in there. The two choices I will have to solve that come from that back page of implementing those other measures if the health care plan doesn't go through. I will likely go to the wage concession, and failing wage concessions, I will probably go to the layoffs. So it's not a threat, but I don't want to say it happens on July 1st or else. If we're in good negotiations, good discussions with employee groups, we can work through this plan and get it to where it's something where it's a go or no-go. But I do have to tell you that I'm going to get from the council the authority to manage the budget next year to meet the goals of solving the $4.6 million problem we face without upsetting our future ability to run the city. So we've got some time. We're starting today. It is important you take the time to look at this plan and the opportunity it provides. It is a proposal. It will be discussed again, and I'm not quite sure it's all going to be done by July, and it doesn't necessarily have to be. But there is a point where we have to begin to pull the trigger. The farther we go into next fiscal year, the more money we spend.
So you wouldn't have, if the business units are in talks with you, and July 1st is usually when you would take out the 6% pay reduction, then you wouldn't take it out that first pay period in July, you would just say,
Well,
we're gonna wait?
No, I wouldn't do that. I've got agreements with folks, like in OE3, they've agreed to 6%, and I'm gonna honor that agreement. But I also have to treat that group fairly. They were at a point of already made a decision for next year. If this healthcare plan is implemented, we will treat those employees fairly. So the money might go back to them. Maybe they will open a discussion with us that allows that to flow back to their health savings account, comes back to them. But, you know, I really want to have a good dialogue with Local 3 and let that business group, business unit, digest what they're hearing and make some decisions. But we can't go into next year without having the ability to make a business decision, but give time for people to be treated fairly and fairly represent themselves through their business units. So we're going to do that. And it's a little bit of risk on the management side, but I believe that that risk is appropriate given what our employees have been through and what this change means for us to be a little bit flexible on that. We could be, this is going to happen July 1st, but I'm really asking the council, and I think they'll support the employees going through this with the triggers of making this budget work. If you go too far into the fiscal year, it would be a greater percentage of concession or more layoffs. So there's a little bit of area there that we want to work with our employees to find the best answer. Thank you for the great question.
Jeff? When you were just talking about OE3 and the fact that we've agreed to the 6%, and let's assume that a couple of the other bargaining units don't agree to the 6%, and they agreed to the healthcare thing. You said that we might get that 6% back. Are you saying that there's a possibility that we'll take the 6% hit and have this new healthcare plan?
It's a long question, but so that it's on the record, you're asking a question of are we going to treat Local 3 employees fairly? In the sense of not having them do something with a committed 6% and that we don't apply different standards to other business units. Those are subject to separate collective bargaining arrangements. So I can't commit what will happen in the IFF or the SPPA. They have to meet with us and open their discussions and form their decisions. But I can tell you what is the critical thing here is the council wants to be fair to all employees and treat them with 6% across the board in next year. So Local 3 isn't being asked to take more than that or less than that. They're being asked to do that. This healthcare plan proposal is in balance with achieving 6%, and I think it provides longer-term economic benefits. There's a business decision that the council will make, and they have to decide where these cuts fall outside of where we have agreements with employees. Layoffs are not, as I say, no layoffs. That's subject to the things we control. And I don't control sales tax or property tax, but we've got a good plan. We've met that plan for the last 10 years very conservatively in our budgeting. And I'm willing to say to you that we're going to treat Local 3 employees who have a collective bargaining agreement with us as fair as we can, and keep in mind that they've agreed now, and not have these things double hit them or have them pay twice, those kinds of things. That's not right. Okay.
I'm not hearing you say, though, that we might not get hit with both. You're saying
No.
fairly.
I would say, Janice, the health plan is in lieu of the 6% increase.
It's one or the other.
It's one or the other.
One or the other.
So-
But is it gonna apply to all, everything?
It does not have to.
Bargaining groups?
Does not. Mm-mm.
Okay.
We are asking the bargaining groups for 6% for healthcare or something
So
equal to 6%.
bargaining groups may have the new healthcare plan. and
Yes.
those
Others
of
may
us who
not.
agreed to 6% might have the old.
That's correct.
You're correct. You are correct that the business unit has to make a decision on that. We will approach them for this new health care plan. If they choose to stay with 6%, that is something they can do. Okay, not doing both. Okay.
Tracy?
So if the health savings account is not in effect till January 1, what's in effect July 1? That's 6 months, so there's a 6% still missing, right? Is it-
Well, with the exception of OE3, it would be our hope that we would come to an agreement before July 1st. That's Sean's very generous at his time, but, I mean, just to ease the confusion, if you agree to the new health plan, OE3 agrees to the new health plan, we would not deduct the 6% come July 1, if OE3 wanted to go to the new health plan.
But when does the new health plan start?
January
Keep the
1.
old health plan?
January 1.
January?
Any employee will be covered by the old health care plan until December 31st of next year. This plan would only take effect on January 1st. That is factored into the budget of the city to pay the health care plan that you're on, and then make the switch on January 1st.
Wayne, did you have a question?
Yeah. If OE3 agrees to the health plan, say August 23rd,
Yes, sir.
okay? So from July 1st to August 23rd, there's a 6% pay reduction that's been agreed to currently, correct?
Yes.
Yes.
Okay? So as of August 23rd, we agree to this health plan. Is the reduction in pay paid back to the employee?
You know what, it's something that you and I have to talk about. Something that we'd have to talk about.
That's a matter of collective bargaining. Your question is, if Local 3 did agree to the health care plan in August, but the 6% cut started July 1, what would happen to the money that had been deducted from the employees? Subject to collective bargaining, but I can say that we would intend that it'd be 6% for the year, and would look for the employees to get their money back or into your health savings account, or how the employees would choose to use it. But we are not looking to put more than 6% on any group during the course of the year. The 6% you've agreed to in Local 3, they've agreed to 6% plus half of the PERS. That is what we're trying to seek, not to double hit anybody. Now, the exposure for layoffs is there for everyone, every bargaining group, every business unit. But that's, Local 3's in a good position of making this decision through their representation.
I just have one more. When you discuss taking the sick days and applying it to the
HSA?
the plan, is it based on my wage, or is it one base wage?
It would be based on your own. It would be from your sick leave balance directly. Sorry, the question was, if we cash out sick leave, is it at your rate or a composite rate? And it's at your rate. Yes, sir.
You guys mentioned the executive level benefits for the city council that they accepted by resolution. Does that differ from what employees get as far as medical benefits?
It is not, I'm sorry, the question is are the benefits by the city council by executive resolution different than the medical benefits carried by the rest of the city? No, they're not. It's all the same medical plan.
Would they also be subject to this new health plan?
Yes, they would. The question is, would they be subject to the new health plan?
They will be asked to participate in the healthcare plan. Any elected official is entitled to what is on the books in terms of a resolution and what is in state law. Our city council, every single one of them, agreed to wage concessions this year in the amount of 7.5% from either pay or benefits, just like the executives did. And they did it the prior year at 4.2%. Some of them went beyond that, but all of them have elected officials on the mayor and council level have agreed to this change. They would be making an individual decision as a separately distinct, defined type of employee, elected official. I can tell you, as Ed spoke, he's made his decision that he's going to match the 6% next year, and he's looking at this healthcare plan as the best option for him and his family. But I wanted to be clear that we're offering this plan to them, and they are treated individually. They're all like business units, if you will. And the resolution would be in their hands to change and approve, just so we have it exactly right.
Thank you for that clarification.
I have one more. What's the percentage of savings going to this health plan for the city?
It's equal to the 6% salary reduction.
So that's what it's going to say?
Yes, that's how we designed the plan.
Hopefully more in the future.
But that's how we designed the plan, was based on that. Jean, did you have a question?
If you opt out, what's the city's resolution to sick buyout at that point?
That is a question that the question is, if you opt out, do you lose your right for sick leave conversion? Is that what you're asking? I don't know the answer to that, and I would think that that would be, I don't know. I know you wouldn't be able to participate in the health savings account because you're not in the medical plan, but I do not know that answer.
Is that up to, do you think that's to the bargaining units to negotiate, or is that kind of like a citywide thing like it currently is? Because it's basically like a percentage now.
I'm not sure. I'm not sure if there might be something in our medical plan that says you have to be covered under our medical plan to continue it. So I'm not sure. That's why I didn't want to give you an answer and say it's up to the bargaining unit, because it may be a plan issue as well. So I will find that answer out for you. Sean, did you have a question? No? All right.
I have a question, Chris, for clarification from my part. If you're in a bargaining unit, can you as an individual opt out? Or do you have to do whatever the bargaining unit does?
The question is if you are in a bargaining unit, can you opt out? The answer is, if your bargaining unit selects the high deductible health plan, you can opt out under the cafeteria plan and opt out as an individual and get the 65% payout.
Well, thank you for your questions. We're going to use your questions today along with this presentation, put it on the city's website. We're going to keep information coming. Your healthcare committee members will be heavily involved in shaping this proposal in coming days. And we will use, as I said at the beginning, the city website. If you have a question, please ask it, and then we can get everybody the answer. And our commitment is to put the answers up as quickly as we can humanly do it so that you have those things. I want to thank you for taking the time to come. And it means a lot to the city that you're here today. And Dwayne, especially you coming as representative of so many of our employees, I'm glad you're here and wanted to thank you for doing that. Thanks for coming. Have a great day, and look forward to working with you on this proposal. Thank you.